I already discussed type 2 diabetes in the last episode, and today we are going to look at type 1 diabetes and other forms of diabetes. Type 1 diabetes is very different from type 2 diabetes. Only about 5% of people, or less than that in India, have actually type 1 diabetes. In type 1 diabetes, insulin production is practically zero. Therefore, they are completely dependent on insulin to stay alive. That means the treatment has to be insulin and not oral drugs. As opposed to type 2 diabetes, type 1 diabetes is seen in children and maybe young adults. I am of course going to talk in a separate episode about how to handle type 1 diabetes in children. But for now, remember that in type 1 diabetes, insulin is absolutely necessary. The patient is often thinly built or has rapidly lost weight. The sugars are often quite high, sometimes going up to 600. And if insulin is not given, or if the child or the adult is not treated, we can develop very severe complications like the sugar going high, acid being produced inside the body, or there is the formation of what are called ketone bodies. And this can really result in a serious complication called diabetic ketoacidosis, and patient will need to go to the hospital. There is another form of diabetes which is seen in the second or the third trimester of pregnancy, and that is called gestational diabetes. And this is seen because of the changes which occur in a pregnant woman. This tends to typically go away after delivery, but sometimes may remain or sometimes may come back after several years. And this is also important from the well-being of the child. We'll look at this again in a separate episode. And then there are other forms. Some people develop diabetes due to certain drugs like steroids or some drugs used in psychiatry. There are other hormonal disorders like tumors of the pituitary gland, tumors of the adrenal gland, which may secrete some hormones in large excesses, and therefore diabetes develops. And another form of diabetes is called pancreatic diabetes, where the pancreas gland, which produces insulin, is damaged due to some reason, and therefore diabetes develops. I know diabetes can often be a lifelong partner, but my advice to you is, don't worry. Be aware and take care.